All right, gentlemen. So we were going to get started here, and we're going to just talk about social media and online medical communities and how you have seen the emergence of digital technology impact the way you and your peers are collaborating. So I'm going to start with Gary, and we'll go around the virtual room here. Gary, how is it changing the way?
Yeah, I would say that in the last few years we've seen a lot more tools available for physicians to communicate, to be hyper-connected now. In the consumer world, we have Facebook, Twitter, and we're starting to see that there are also very specific tools for physicians and healthcare providers to communicate. And Eric, you mentioned MedTing, for example. That's one excellent example. There are others as well. So basically what I was starting to mention was we're fortunate to have a lot of new tools, especially for physicians and healthcare providers. And Eric, you started to mention MedTing, and many tools that are really available for collaborating and meeting new experts, people in your field. And one of the things I found really refreshing is that you can really use online platforms to discuss any topic with anyone. So, for example, you can share radiology cases on radiologists. And so being able to share an interesting case or to see an interesting case through social media, through online platforms, of course, while keeping with privacy concerns, keeping everything anonymized and abiding by any policies that your institution has, using online platforms is really a great way to communicate with other healthcare providers. An example is using this in outreach. For example, I do a lot of teleradiology outreach where I look at cases, teach residents from Africa, Haiti. It's a really great way and low-cost way of collaborating. Another use case besides teaching or outreach is you can store online teaching files. So radiologists like to collect interesting images. So you could actually use something like MedTing or other platforms to really store your teaching materials for future use or for future presentations. Online platforms also allow for connectivity to other sources of data like news, latest reader, for example, PubMed, CME. So online platforms really are changing the way physicians can use their time to consume the appropriate information, also deliver, whether it's education. And I'll to this maybe later, and how online platforms can start to deliver clinical care.
Ryan, what about you? Do you see it, certainly like at a university, do you see the impact of digital communication amongst your peers changing the way doctors are communicating versus when you were in residency?
I think in the last year there was a great increase in the number of physicians, both private and academic, who started to join LinkedIn. Now, they don't always know how to use it or use it optimally, but they're at least joining the realm of business. The other things that are happening that I don't think anyone's mentioned yet, I think Gary may have mentioned a little bit about telemedicine with radiology, but this is really transforming care to areas that don't have a lot of access. The University of New Mexico has a big center, and they actually published a study in the New England Journal last year or 2 years ago where they used telemedicine to collaborate with physicians in a rural setting to provide care for patients with hepatitis C, which is really phenomenal. And now this is starting to really take hold in a lot of different communities. Another thing that's happening, there's things like teledermatology, where you could take a picture with your cell phone and take a picture of a patient's rash or a patient's lesion and try to figure out what it is by sending it to another dermatologist. Now, I'm not in the field, so I don't exactly know how that works, but this is another option. And even PubMed, even the government is experimenting with its own form of social media on PubMed. I think it's called PubMed Commons, where you can, if it's in beta testing still, but you can comment directly on the abstract just by going through PubMed. And this is really going to change. This is going to change the way we think about research, about data that comes out. You're going to be able to communicate with the authors, potentially with the authors of the trials or other people, and express concerns about the research that would never get published in a journal otherwise. So I think there's a lot of new things that people are experimenting with.
That's fascinating. Well, what's the timeline for that? Do you have any idea? Have you seen that in action? Are you getting involved in posting comments on
I have seen it in action. I see it. PubMed Commons. It's I've seen it. It's not taken off yet, but that's because it's in pilot testing, and they must be doing some stuff behind the scenes. When I think when it goes live formally, you have to right now apply for an account. I've posted on a few abstracts, not that many, but so far I've posted. It's interesting. I think it's really going to change the landscape of academia to allow everybody to have a say and in what the data means, and then really it's the biggest form of peer review you can have. We're going to do a session once this goes live with the medical librarians, because this is a great opportunity for the MedEd chat group, the medical education group, and the medical librarians group to just really collaborate. So now we're knocking it, not just collaborating with physicians, we're talking about interprofessional collaboration. So this is just a great opportunity.